Alison, do you want to let me know when you're ready? I'm not going to take, I know you're kind of just tweaking everything, so if you let me know.
I'm just struggling to present the screen with me being able to see my notes. So if it's okay with everyone else, I'll just do it this way, if that's okay.
Yeah.
Do you want me to kick off whenever?
I was just going to say, we've just got Alison online. She's from the Stroke Association. She is a Stroke Association support coordinator for Halton, and I'll let her explain a bit more about that role and a bit more about Stroke Association support. So over to you. Oh, I was just going to say, sorry, if everybody can keep on mute today. We're just having a few IT gremlins. It seems to be a bit crackly between a few of us. So if everyone can remain on mute. If you have any questions and want to put them in the chat box, or raise your hand and we can go through them at the end. Okay, so if I hand over to you, Alison.
Yeah, that's great, Louise. Thanks a lot. I think what I'll do is different sections, so I'll probably just pause after each section and see if anyone's got any questions if they want to unmute. And Louise, would you be able to see if there's anything that comes up in the chat bar?
Of course I can, yeah.
Brilliant, because it is hard to do that when you're trying to do the presentation as well. So yeah, like Louise has said, I'm Alison. I work for the Stroke Association as a support coordinator in Halton, and I've just been invited along today just to help you learn a little bit more about stroke, what we do as a charity, and how to reduce your risk of stroke. I've worked for the Stroke Association for 9 years now, and while my job is to support stroke survivors and the families, it's also important to raise awareness about strokes, because as we'll learn, a lot of strokes are preventable. So today we'll cover, talk about information about stroke, what it is, spotting the signs of a stroke, the impacts and the effects of stroke, how we can all look at reducing our risk, and then what we do as a charity and what we do locally as well. So general information, just first of all, I'd like you to sort of introduce you to Amber. Amber was at home for the summer holidays after she finished her first year of uni. She started to get migraines and numbness down her left side. She went to A&E, and then while she was in hospital, she had quite a few big strokes, which took away the ability to walk and speak. Be interesting to sort of see from the people who are on the call today, has anyone here had a stroke themselves or know of anyone who's had a stroke? People want to unmute and say. Could be yes, could be no.
Well, I can, yes, a member of my family had a stroke, but can you hear me?
Yes, I can hear you.
I remember, well, it was actually my grandmother had a stroke, but she was 80 years of age. It was a long time ago, but she did have a stroke and she had aphasia. So obviously her speech was affected, and she took a stroke. In fact, it was the only illness she ever had in her life. Wow. And she sadly died 1 week after having the stroke. So, but I suppose at 80, I shouldn't say this because I'm a trustee Age UK, so I don't want to say as you get older, you should expect it, but as we all know, as you get older, you know, health does decline. That's a fact of life. Sure. But yeah, that was good. That's the only member of our family that's had a stroke.
Okay.
But no young members, God willing, no young members.
I can see, Irene, you've got your hand up. Do you want to say something there?
Yeah, I've had family and friends have strokes. My best friend has a stroke, and she was sent out to hospital just totally confused. And when I went over to see her, she said, "I know your face, but I don't know your name. I've been mates with her for years and years." And then sadly, her husband had one. I've had a mini stroke caused through stress. I've forgotten the name of them. There's a name, isn't it? Is it? It begins with a T.
Yeah, you're right. It's TIA, and I will cover that actually. So yeah. Go on. Yeah. Anyone else? Nikki, you got your hand up.
So my nan had a series of the TIAs, the mini strokes. I think she did have a couple of like full strokes as well. but the TIAs were funny. I was with her a couple of times when it happened, and they were strange to see. It was kind of hard to know the first time what had happened, and we think she'd had a series of them. She just wasn't a word. She just had bruises on it, and she'd said that she was like making some toast, and then she just remembers waking up on the floor and things like that. And it was like the breadboard that had fell on her. But more recently, I've heard somebody somebody around my age that's had a stroke as well. They've been in quite a bad way from it.
Right. Go on, anyone else? Ashley?
Yes, my grandmother is the person in our family who I know who had a stroke. She just woke up in the morning and her left arm was feeling a bit numb. And then when she turned to get out of bed, she noticed in the mirror that her face had kind of drooped to one side. So she'd gone to call my uncle and was trying to talk to my cousin, and she also had difficulty with her speech.
Okay.
About that really affected her down her left-hand side. But also more recently, like I sometimes get migraines, and I'd been to the hospital because I also have numbness and a few other things that occur. And they were worried at one point that it might have been a stroke, so I got checked out for that. So it just got me thinking about it a lot more recently.
Yeah, wow. So, I mean, I don't know how many people are on the call today, but just from what people have said, you've got personal experience, and you've got sort of family members as well who you know of who had a stroke. So, I mean, it's true. Moving on to the next slide, there are sort of 1.2 million stroke survivors living in the UK. So that is quite a lot of people. It roughly makes up about 2% of the entire population. And to give it some sort of local context, that's around 10 times the number of people who live in Halton who are living with the effects of stroke. So, yeah, I mean, we've touched on it already, is that stroke can happen to anyone. Although, as we do get older, the risk, it is more common in older people. But people are having strokes at a younger age. Around 1 in 4 strokes happen to people who are of a working age. And babies and children can have strokes as well. There are over 400 strokes a year in the UK. So that just sort of puts it in perspective, really. And I mean, Amber, the case study I used, she was 19 and she had her strokes. People think it is something that only happens to someone as they get older, but it can happen to anyone at any time, regardless of age, sort of gender, race and social status as well. So it could be, I don't know, a father of 3, a baby, a young girl, first time mum, and obviously a much loved grandparent as well. So just to sort of stress that it can happen to anyone at any time. So in the UK, stroke strikes every 5 minutes, and there are over 100,000 strokes in the UK each year. A good thing is that over the recent years, improvements to stroke care mean that you're much more likely to survive a stroke compared to 20 years ago. But it is still the 4th biggest cause of death in England and Wales, behind sort of cancer, dementia, heart disease. And when someone has a stroke, it has a massive impact on the life. As people have experienced, it can rob you of your speech and ability to walk. It can also affect your vision, memory, concentration, emotions and personality as well can be affected. So there are a lot of people out there living with the effects of stroke, and it causes the greatest range of disabilities than any other condition. So 2/3 of stroke survivors will leave hospital with some form of disability. It could be quite mild or quite severe. And if you can imagine how that affects people on a day-to-day life, it affects their independence, the confidence as well, and the emotional well-being. And it can have a significant knock-on effect on work and family life as well. I mean, the good thing is, strokes are preventable. So 90% of all strokes worldwide are preventable. And we want to sort of change the way people think about stroke. So many people don't understand it or think it'll ever happen to them. And there are things that we can do to reduce the risk of stroke. So that's why I'm here, really. I mean, some of you are aware of what the signs and symptoms are, but it's always good to go over that and reinforce that, and to tell family members as well, because it is important to spread that message to prevent strokes from happening in the first place. Then we've got any, before I move on to what is a stroke, has anyone got any further questions or comments or thoughts?
Yeah, I just wanted to add, I think it's really important to get those statistics out about how common strokes can be in the different age ranges it can affect. Because I've heard, like I said, I've heard of one my age that's had a stroke recently, and one of my friends is not the same person, but has heard of 2 others. So then that's leading to all that talk, oh, they've had the jab, it's because of that. So I think it's really important to get the information out there that actually they are really common across the age, and not just assuming that it's older people that are at risk of having a stroke.
Yeah, I mean, there is, again, with the sort of situation we're in at the moment with COVID, you know, the link between, it was the AstraZeneca, wasn't it, and the risk of blood clots in younger people. I mean, the risk of that happening is so small, yeah. But yet there are 25, so you're looking at 100,000 strokes a year in the UK, and 25%, so 25,000 of those will be of younger people. That's still a lot of people of a working age who are having a stroke. Yeah, and it can, I mean, we are noticing in Halton that people are younger. I'm just thinking last few months, 27-year-olds, 31-year-olds, 26-year-olds, 50-year-old. So they're all young people. And the reasons they have a stroke are different from perhaps someone who's in their 80s, 70s, 80s, which we can sort of go into and perhaps look at that further.
Yeah. But I think that's the thing, isn't it? Because the situation that we're in, and because people are having the jab, it's like, oh, I was off with a sinus infection, and somebody else was like, oh, I've heard somebody had a sinus infection after the jab. Could be linked to that, and it's like, no, it's not. I've just had a sinus infection.
Yeah. People like to sort of make sense of things, don't they, and attribute sort of cause and effects. That's what we like.
Yeah. Like, no, I've just had a sinus infection.
Yeah, I know, but it's like Chinese whispers then, isn't it? And then before you know it, you know, there's a lot of people who won't have the vaccine.
Yeah, one of my friends, I think she had an appointment and cancelled it, didn't go.
Yeah, and that's her kind of right, isn't it? It's her choice. But when you actually unpick it and find out, well, what's stopping her from going and having it, it could be, you know, quite trivial things, but for her it's what's really important, and it means a lot.
Absolutely, yeah.
Irene, did you want to say something?
Yeah, is there a link between strokes and diabetes? And the reason I ask for that is that the vast majority of people I know who've had strokes have also got diabetes. I mean, I didn't experience loss of speech or anything. I just felt like the back of my head was just totally numb and down my face, and it frightened me. And it wore off. But when I went to the GP, that's what he told me it was. But even my grandma had diabetes, my friend had diabetes, her husband's got diabetes. And I just wonder, is there a connection between diabetes and stroke?
The simple answer is yes, there is. There is a link between being diabetic and stroke. It does increase your chances. And the reason, I mean, and that's why it's so important, which there's a few slides later on, that it is, if you are diabetic, that you control your diabetes. That's so important, is and taking up all the screening that you get as well with being diabetic. So having good sugar control is really, really important to reduce your risk of stroke, because when you are diabetic, it affects the lining of the blood vessels, so it makes it harder, and having high blood sugar, it kind of affects the blood vessels in your brain, so potentially that's why having good control of your diabetes reduces your risk. If your sugar levels are high, that's when it can lead to a stroke, because it damages the lining of the blood vessels.
Oh, thank you.
So there is a risk. If you want some more information, we do have a fact sheet on diabetes and stroke. It is available on our website, or I can send it to you separately, Irene, whatever, if you want some more information.
Thank you.
When I was a health trainer, we did the IGRs, the impaired glucose and the HbA1c test, the pre-diabetes. We did them, and we went on some training. They explained it really, really well, and it stuck with me. I worked really well with analogies, those very visual descriptions. And they said, so if you'd imagine it, if you've got too much, if you'd imagine the sugar in your blood as the granulated sugar that you get in the bag, and imagine that passing through your blood, and it scuffs the inside of the artery.
It damages,
and then that gives, so then that gives the plaque something to stick to.
And it can break off then and travel and then cause a clot.
And that just kind of stuck with me, and I used that to explain it to people who were like, right, I get that. That makes sense.
Yeah, because a lot of people who are diabetic, they think they don't really understand what being diabetic increases your chances of other health conditions as well, but particularly stroke, and that's the reason why. So a lot of people, it is about taking their insulin and the metformin, and having a good diet, because combined with all those together, it results in good control and reducing the risk of the blood vessels being damaged. So what is a stroke? So there's two types of stroke. Basically, a stroke is a brain attack. So that so when that happens, is the blood supply to part of the brain is cut off. So without the blood supply, brain cells can be damaged and they die. There's two types. Most strokes, around 85%, are caused by a blockage, such as a clot, which cuts off the blood supply. The technical term is ischemic stroke. Amber, the case study, she had multiple blood clots, which caused her to have several strokes. And that diagram, you can see what it does in your brain. So the blockage, it stops the blood going through to part of the brain. And then the second type of stroke is caused by a bleed. So that's when a blood vessel bursts within the surface of the brain, a hemorrhagic stroke. They are less common. Only 15% of all strokes are caused by a bleed, but they can be more serious, and they are associated with a higher risk of dying within the first 3 months and beyond. So that's quite scary to know. But there's two types. Most people have a clot. And then moving on to what Irene mentioned before about these TIAs, mini strokes. So TIA stands for transient ischemic attack. It's the same. A TIA is where people get stroke symptoms, but they only last for a short amount of time. So people tend to say, oh, I felt funny for, I don't know, a few minutes or a few hours, and then I returned to normal. So a TIA is when people have symptoms, but they are back to normal within 24 hours. So a TIA is when the blood vessel in the brain gets blocked temporarily, but then the blockage clears. So so many people have said to me, oh, I just had a funny turn. That's a phrase that comes up time and time again, a funny turn. And although it doesn't last long, it's still quite serious, because it's a warning sign that there's something not quite right. And it could be the fact that they will go on to have a full stroke. So the stats are that 1 in 12 people who have a stroke within a week of having a TIA, and all strokes occur after a TIA the first 24 hours. So it's so important. Irene did the right thing by going to a GP. GP can refer to hospital TIA clinics. TIAs are quite difficult to diagnose because they don't show up on a scan, a CT scan. So it's so important that you tell the doctor exactly what happened, and they'll base their diagnosis based on what you tell them. So yeah, TIAs are really important, and they are classed as a medical emergency. People don't like calling 999. There's a real sort of stigma attached to, especially at the moment, we know how busy A&E departments are. But we still say to people it is a medical emergency. A lot of people use the 111 service, and they decide whether to call an ambulance and to seek further advice. But going to your GP can sometimes prolong things as well. They don't react quick enough. So we do say it's a medical emergency. Anyone got any questions before I move on? Any thoughts, comments?
Can I say something?
Of course, yeah.
Something I was discussing with an organisation just the end of last week. And it's something that's been discussed with hospitals and so forth. To look at the primary care system, you said to contact your GP. The GP, the practice that I attend is very good, very helpful. But to be honest, at this moment in time, if anybody can find a GP in Halton, I think they'd be doing exceptionally well. Now, I myself am waiting for an operation, and I know if I have a particular problem, which I could have, I have absolutely no intentions of contacting my GP. I will go straight to A&E.
Yeah.
Because, and I know things have changed, because the Witness Vikings a couple of years ago did a very good video about making sure people don't waste the time of A&E. But I think you'll think things have actually changed now, because even my consultant, when I asked him what I should do, he said, go to A&E. And I said, what about the GPs? And I'm trying to remember his actual response. Something like, there's little point in doing that. Now, I don't want a GP bash, because I did this the other day in a Zoom meeting with hospitals not a million miles from here. And I've got to say, every single person agreed with me. I think GPs, I know it's because of the coronavirus that we don't get to see them face to face, but they've come to the point that anybody who can actually manage to get any contact with a GP is doing exceptionally well.
Yeah.
They've become too unavailable to the general public. And I've spoken to friends, and as I say, I won't mention the professional people I've spoken, but I have spoken to professional doctors and nurses who actually do not disagree with me. They say they understand. It's your point about contacting GPs, but I think if you can find a GP, you're doing exceptionally well. They've actually, let me just set the record straight. There are GPs who are going that extra mile and who are doing wonderful things for their patients. That I accept. That's. But I think when you look at the media, maybe they've got poor PR. When you look at the media, you see the wonderful doctors and nurses in the local hospitals here and hospitals throughout the UK doing great things for coronavirus and other things. And at the other talk, I saw another television program where a GP actually came on television and said, I have to do 30 phone calls a day. And I thought, how ridiculous is that statement? When you've got doctors and nurses risking their lives to save the patients in hospital, coronavirus, and you've got the GPs, let's just say the GPs are not showing themselves in a very good light. So I don't want to start a separate discussion, but to be honest, the last person I would contact with a health issue would be a GP at this moment in time. That's just, that's my opinion. And let me tell you, at least 20 doctors, I'm not a doctor, at least 20 doctors I've spoken to have said they understand. They don't necessarily agree with me, but they understand why I think that way. Why should, you phone the surgery, the first thing the receptionist does is try and make sure you don't talk to anybody. When you're ill, you don't have time for this. You don't have time for these shutters to go up. And that there's no reason. I know it comes from the surgical board, whoever they are, the medical association are advising GPs not to be face-to-face contact with patients, obviously because of the coronavirus. I understand that, but they've just retracted so much. It's as if a neighbour actually said to me, they wouldn't know the difference. If all the GPs in Halton left, they wouldn't know the difference. You know, as I say, I don't want to upset Healthwatch.
Yeah,
but this is the public,
agree.
the public. So I just want to say, so this is the public view of certainly the people I've spoken to. The public view is, where are they? So if I took a stroke, probably I need my wife's help. I need somebody to help me. They just dial 999 immediately.
Yeah, completely. And it is, I mean, both a stroke and a TIA are what we class as a medical emergency. So we just say straight 999. But we do hear stories of people getting in touch with the GP, and then they're not happy when the GP doesn't respond quick enough, because, like you've said, they're not there to react in that way. So it is encouraging people not to go down the GP route. It's so important to pick up the phone and dial 999 and let them make the decision whether you need to go to hospital or not. It might not be a stroke, but obviously the paramedics are the experts assessing people. So let them, we always say, even with a TIA, it is still a medical emergency, which isn't the GP isn't the right route. 999 is, but you're right, it's kind of a separate issue, isn't it? It's how GPs
I just want to say, don't misunderstand what I'm saying. This, as I say, the practice I belong to, and it's been for 27 years, has treated me exceptionally well. So I think whoever's advising the GPs, I don't think they realise that the public is losing confidence. I've got a meeting at 1 o'clock today to discuss that exactly with people who know more about this than I do.
Yeah.
And it's all about lack of public confidence. And as you say, if somebody has a stroke, they need help very quickly.
Yeah.
Yeah.
Yeah, and it'll be interesting to see how that meeting goes, Colin.
Yeah.
So I'll just move on to sort of spotting the signs of stroke. I mean, some of you are aware of it, but again, it's always good to reinforce the message. Again, stroke is a medical emergency that always requires urgent medical attention, and there are people on hand to assess you and to decide on the best course of action. Every second counts when people have a stroke, and recognising the signs and calling 999 is crucial. The quicker someone arrives at a specialist stroke unit, the quicker they will receive the right treatment for them. Obviously, you've probably heard and seen the FAST campaign, and that's really important to help people recognise the signs and symptoms of stroke. And the Stroke Association sort of was helped with the funding of that and the development of that, a message of the FAST test. So moving on. So the FAST test, simple way of identifying the 3 most common signs of stroke. So any sort of facial weakness, look at the person, ask them to smile as it fallen on one side, ask them to raise both the arms and keep them there. Chances are one will be up here, the other one will be, they won't be able to maintain it, or it wouldn't even be able to raise it off the chair that they're sat on. Has the speech been affected? Ask them to say the name or say hello. Is it slurred? And what people sometimes forget is that you don't have to have all of these symptoms. It can just be one of them, and it can be quite slight as well. It's not always as obvious as what the advert on TV makes out. It can be much more subtle, but you don't have to have all of the symptoms, just one of the signs, and it is important to call 999. So they're the main causes of stroke, is facial weakness, arm weakness, and speech difficulties. But there are some other signs to look out for as well. Any sort of sudden weakness or numbness on one side, including the legs, hands, or feet. Not necessarily slurred speech, but being able to speak in clear sentences, or maybe just talking gobbledygook. Any sort of vision problems as well. I can, and you can see why, if someone's can sometimes have these when they have a migraine. You mentioned that, Ashley. So again, it is important to get checked out if it's different from what you normally experience. memory problems and just been acting a bit confused as well, or if they're just off balance, as walking around as if they're a bit drunk, bumping into things, sudden headache as well, and feeling sick, again, can be linked with other conditions. But so these are sort of other things to look out for. Doesn't necessarily mean it's a stroke, but it's not always as obvious as the advert, and it's not always as severe as well. And again, it is important to call 999. Paramedics are trained and they will decide on the best possible treatment for that person. If that means a hospital admission, then I think it's important that people do get checked out. And that's been another problem with COVID as well, people not wanting to go into hospital. So when probably about a year, this time last year, we were finding that the number of people being admitted to hospital with strokes just gone way down because they were too scared to go into hospital in case they caught COVID. So it is trying to build up, and there was some sort of campaigns to really push the fact that stroke is a medical emergency. Because at one point last year, the stroke wards were empty. People just weren't going. People were still having strokes, but just having them at home and not seeking medical advice. So when people do get, oh, Nikki, do you want to say something?
Yeah, I was just going to ask, I don't know whether I've made this up, but getting them to pull tongues. Does the tongue go to one side?
Yeah, again, it's all to do with if it falls to one side or anything to, it's just worth doing, isn't it? Because there has been a campaign on social media. I've seen that as well. But it's a combination of factors. I always say to people, go with your instinct. If something's not right, ring 999, because chances are there is something wrong, and that's the paramedics are the best people to determine whether it is a stroke. So when someone does have a stroke, the impacts can be quite significant. I mean, going back to Amber when she had her stroke, she was taken to their specialist stroke unit in London. And hers was quite severe, that she was put into a coma and she had to have part of her skull removed because the swelling in her brain was so severe. So that was to relieve the pressure. So for her, she had problems with her speaking and her walking after a stroke. And they're probably the two main things that people think of as the effects. So when Amber had her stroke, she woke up and she was, discovered that she couldn't walk or talk, and then needed assistance with everything, and things that you just take for granted she needed help with. So this is the reality for stroke survivors, is that they've gone from being independent to needing help and support, and the impact that has, it's life-changing really, and it's terrifying, not just for the person but for family, because it has a big impact on the family as well. So looking at the sort of physical effects, obviously you can see there memory, thinking, vision, speech problems. Aphasia is the sort of technical name for it. Swallowing difficulties as well. So some people are unable to have to eat and drink normally. They have to have a tube, fed through a tube, or they have to have like pureed diet, because a stroke can affect the swallowing, the muscles that coordinate that swallowing reflex. So as well as having those physical effects, there are hidden effects of stroke as well, that are not visible. Fatigue is a massive problem. 50% of stroke survivors do say they do suffer from fatigue, and also 50% of stroke survivors will suffer sort of depression, anxiety as well in the first year following their stroke. So that's huge as well. The effects of stroke depend on where the stroke is in your brain. and also how much damage has been done. If you think of your brain as being a bit like our motorway network, you've got your motorways, you've got your A roads and your B roads. If you have a stroke in one of the large blood vessels, a motorway, the impact is going to be much greater than if you have a stroke in one of the smaller blood vessels, like a B road. It's much smaller, the impact. So as well as physical effects, there are hidden effects as well. And just really, it has this huge effect on the stroke survivor, but it can also lead to feelings of shock, worry, and even guilt amongst family and friends as well. A lot of stroke survivors may need support after they leave hospital, and it's often a family member who takes on that role as being the carer. And that can take many forms, from just doing shopping, cleaning, sorting out the bills, to involved in personal care as well. So it is important to recognise carers in this. They can often feel overwhelmed, exhausted and isolated as well. It can have a significant impact on finances, because sometimes the carers are unable to work or have to reduce their hours in order to care for the stroke survivor. So it is important that we do recognise carers, and it's support them really with emotional problems, stress, depression, and to try and reduce the impact of their caring role on them as well. I mean, we are quite lucky in Halton. We do have quite a lot of support for carers. Obviously, people can have a carers assessment, and through social services, there is support for through Crossroads for 4 hours of support a week to give them sort of time to do something to relieve them. And then someone can sit with the stroke survivor to give them time to do something. So with the right support, lots of stroke survivors make a good recovery. And we as a charity believe in life after stroke. We have lots of support services in place, similar to what we've got in Halton. We have clubs and groups for people to go to. We have a stroke helpline as well, where people can ring up and get information, advice. And we have online support through something called My Stroke Guide. So a big part of this, like we said earlier on, 90% of strokes worldwide are preventable. So it is important to look at how we can reduce our risk of stroke, and raising awareness is key. So it's making people aware of the risk factors for stroke, and the risk, what I mean by risk is your chances of having a stroke. Everyone's risk of having a stroke is different. It depends on their bodies, their lifestyle. But if you understand more about your risk, then you can actually do something to reduce it and do something about it. So lifestyle factors, things like smoking, drinking too much, taking illegal drugs, being overweight, sort of eating unhealthy foods. All these things can damage blood vessels, increase your blood pressure, and make your blood more likely to clot. So this is what I said about the link to diabetes as well. Family history, strokes can run in families. I think if that is the case, it's important that people do seek advice from the GP, perhaps have a health check and just look at advice on reducing people's risk. Ethnicity does play a part as well. Strokes do happen more often to people from African and Caribbean families, and people from South Asian countries like India, Pakistan and Bangladesh. And I think the link there is between diabetes and high blood pressure tend to be more common in those groups. So as well as having sort of family history and lifestyle factors, just the fact that you've had a TIA or stroke previously does mean that you are of a greater risk. But again, if following advice, taking medication is so important, and following a healthy lifestyle, that risk can be reduced. So age as well. I mean, like I said, it is more common in people as they get older, but 25% of strokes do happen of people in a working age. But it's never too late. I think that's a positive message to take from this, that it's never too late to take steps to reduce your risk of stroke. Everyone can do a little bit more in terms of being more active or eating a little bit better and taking treating your health conditions better. The biggest risk factor in terms of health problems is high blood pressure. And the thing with high blood pressure is that there's no symptoms. People feel absolutely fine and feel well in themselves. But it does play a part in half of all strokes, and it is the single biggest risk factor. So I can't stress that enough, is to get people to get the blood pressure checked regular. And if you are diagnosed with high blood pressure, that people take the medication that they've been prescribed. Having a condition called atrial fibrillation, or AF, does put people of a higher chance of having a stroke. It's when their heartbeat is irregular and faster than it should be. So a lot of people who have AF, their risk of a stroke is up to 5 times higher. So if people feel the heart is racing, again, they need to get that checked out and have get the GP to perhaps do a 24-hour ECG and things like that, just to see if there is anything going on there. We've mentioned about diabetes and the link there. It does double your risk of stroke, but by managing it correctly and making those healthy lifestyle choices, people can reduce the risk. And as well as those things, cholesterol does come into play as well. So again, if people have high cholesterol, it clogs up and narrows the blood vessels, increasing the pressure, making it more chances of causing bits breaking off and causing a clot or causing a bleed as well. Anyone got any questions before I move on to what we do locally in Halton and what the Stroke Association does?
Excuse me a second, Alison. I just wanted I got a little bit of interference, and I just don't know whether I heard it or you've already said it. I apologise if you had.
Yeah, go on.
Ethnicity plays a part, and also age plays a part, and also the underlying health conditions. Did you mention gender plays a part, or is it just?
No, gender doesn't really have anything. Well, it can happen to anyone, but there's no sort of significant risk factors there, in terms of people having a stroke. I mean, I'm not sure what the stats are for Halton on gender, in terms of. I can look into that for you, Louise. Definitely.
It was just me being nosy, really. I just wanted to.
Yeah. I mean, in Halton, I'm not sure what the split is in terms of the number of people coming through our service who've had a stroke.
Just curious, really, and I just wondered whether I'd missed something, because, as I say, my machine just had a little bit of a blip. So
okay,
yeah, that's thank you.
Yeah. Okey-doke. So as a charity, we are sort of the leading charity in the UK dedicated to conquering stroke. And that's why we run these vital, practical, emotional support services. We believe that it's essential that all stroke survivors get the care and treatment they deserve, no matter where they live. And so we are actively campaigning for better stroke care and work with politicians to ensure that it remains high on the political agenda. And by listening to and working with people affected by stroke, we can drive those improvements in stroke care. Because if you do look across the country, it's probably a postcode lottery in terms of these specialist hyperacute stroke units. They're not there in all areas. and the chances of receiving the life-saving treatments such as what we call thrombolysis, which is a clot-busting drug, and also thrombectomy. It's a real specialist procedure, and there's not that many people trained to deliver that service. So sometimes it does depend on where you live, and that's why we're pushing for better stroke care and campaigning to get the NHS to look at putting the right support in place. So as well as providing practical and emotional support, campaigning, and we also get involved in research to look at funding prevention, treatment and rehabilitation as well. And that's something that has been affected post-COVID. Our research budget has been cut, which is a shame. I think that's the case for a lot of charities, but we are sort of dedicated to trying to improve the research so we can improve the prevention, treatment and rehabilitation of people who've had a stroke. So locally, our service is commissioned by the local NHS and council to provide practical advice, emotional support, high quality information to stroke survivors, carers and family members. So that involves coordinated support throughout their stroke journey. We go on to the stroke wards at Wiston and at Warrington, although we've not been able to do that because of COVID. But I think that's so important, is to meet people when they are in hospital and introduce ourselves, give them that information and to make them aware that there is support once they get discharged. So when people come home from hospital, we do home visits. We've been doing video calls as well, and just regular telephone support. We put together a personalised plan for people and listen to what their needs are really and support them in rebuilding their life after stroke. Every stroke's different. People need more support than others, and we will adapt our support to meet people's needs. We can help people returning to work, help carers as well. And a lot of our work is signposting to other organisations who can help them as well. We have been running groups, although we have been doing them online because of COVID. But again, that peer support is invaluable for people who have had a stroke. People learn a lot by talking to other people and supporting each other. And we also do communication support, so communication practice for people who have had a stroke, just trying to build the confidence up. So we work alongside speech and language therapy to support people with practicing, just having a conversation with people to improve their confidence and to improve their communication. So that's really what we do locally. It'd be nice to get back to some sort of normality because following COVID, get back to what we were doing prior to the epidemic, and hopefully we'll be able to resume face-to-face groups and things in the near future. I can see a few hands up there. Irene, do you want to ask anything or comment?
Yeah, I as you know, I often go to the Murdershaw group.
Yep.
That's held in Murdershaw Centre, and I know that you probably haven't been able to meet at all. It'd be ideal if you could let us know when you're back up and running and everyone's meeting face to face. But in the meantime, you know, all the groups that are being facilitated, not just in Halton, everywhere, I think it's important that you make them aware of Healthwatch and how they can feed into our Healthwatch.
Sure.
You know, as you're saying, some services need to be improved. Well, we can't really act on that until we're told about that. It's important that people give their experience so we can get all the data and intelligence together and then try and improve services for people. And it's not just lockdown, as you're saying, people who've had a stroke struggle with communication and things. It's bad enough when you haven't got those struggles, trying to get through accessing services. So it's so important that we hear from people who have experienced it all. Thanks.
Yeah, have you noticed in terms of people accessing Healthwatch and explaining, telling you about their experience of hospital, have you had more people getting in touch following COVID?
Yeah, and it doesn't just include secondary services, it's primary services, it's things like your dentist and your GP.
Yeah.
And what another attendee was suggesting, people are struggling to access services, so it must be doubly difficult if you've got communication problems to start with.
Sure.
So it's so important.
I mean, when we do get in touch with people, I think everyone's experience of their hospital stay is different. Some people it's quite positive, but for some people it's negative as well. Yeah. And I think we always stress the importance of telling people putting in a complaint to the hospital, going through PALS, contacting yourself, because that's the way in which a change, you can make a difference by collectively putting these stories and experiences together.
Yeah. So if you could pass that to your colleagues, that would be brilliant.
Yeah, definitely. I mean, we do always mention if people have a negative experience, we always mention Healthwatch and say, look, it's really important to try and prevent someone else going through the same thing as you.
Yeah. And we're always on the end of the phone. There's different ways they can contact us. And hopefully when you all go back together again and you're meeting physically, then maybe we can come along and explain why this is all so important.
Yeah.
Thanks.
Yeah, I mean, the plan is for us to return in July, so the next few weeks. I know Angela, she's been liaising with Murdishaw and she's put together a risk assessment. So I will tell her that you'd be quite keen to come along.
Yeah, it'd be fabulous. Thank you. Thanks.
Yep, will do.
Thank you. Diane, did you have your hand up?
Yes, it's just a quick query. I might have missed this at the beginning.
Go on.
Is it called Have a Go Stroke Club? Is that still in existence in Halton?
It is, yeah. It's called the Let's Go Stroke Club.
Oh, sorry.
No, it's fine. We don't have anything to. They're affiliated to the Stroke Association, so they're a separate charity in their own right. And their group is more of a social group offering support to stroke survivors. My understanding is that it's still running, although they've not been able to meet due to COVID. They used to meet at the stadium. I think it was once a month. So yeah, you're right. It does still exist. Barry Heap is the contact. It could be worth getting in touch with Barry just to see what their plans are for restarting their group.
It seemed to be well publicised. I don't know whether it was well used or not, but there seemed to be quite a lot about it on social media. That's all. I just didn't know it was still in existence or not. Yeah,
it's still in existence from what I know. Like you said, it's not. They're only affiliated to the Stroke Association, so they do their own thing. They're a separate charity. But yeah, they haven't been able to meet, obviously. I'm not sure whether they've been doing any online support. I think they've been doing phone calls and things to the members. And in fact, I did hear from one of my service users. I think they went on holiday not so long ago. Last week, I think they were away. Not sure where they went, but obviously they've managed to go back to doing that sort of thing. Oh, that's good news. It is good news, yeah. Something that people can get some get together socially, out of the medical side of things, and perhaps have some nice times together. Yeah, and that's so important, and we've all missed that, haven't we, over the last year? Yes, we have. Thank you. Okie doke.
Sorry, Nikki, did you have your hand up?
Yeah, just a quick. Did you say you'd been doing the meetings like online?
We have. I'm not sure about the Let's Go Stroke Club. We've been doing both our group at Murdershaw, that's been running fortnightly on Zoom, and our stroke cafe, which was running at Norton Fields once a month, that's been running on Zoom as well.
Are you going to keep that up? Because I know that's something that obviously that we started doing, that I've been delivering my training virtually, and it doesn't suit everybody, but it has suited a lot of people, so we are going to keep it as an option, kind of moving forward.
I think the good thing with doing it on Zoom is that it reduces when someone has a stroke, often they struggle to get places. Transport's a big problem. So that is one thing that Zoom is fantastic for, because you can do it in the comfort of your own home. I mean, there are pros and cons. Obviously, people have to have the technology and the know-how to be able to use Zoom. We have been able to support people to get up and running on Zoom, but it isn't for everyone. So I think sort of having both would be, we'll just see probably how many people return to our face-to-face stroke cafe, and whether there's a need for continuing with the Zoom. Doing both, I'm more than happy to do both, depending on what people's needs are.
I know certainly from delivering the training, people are quite anxious about getting back to normal.
Yeah.
To just kind of, and ourselves included, to just go from being virtual to like, right, okay, we can go back out, we can meet up, so no more, and the sessions are back face to face. I think that's going to be quite unrealistic for us all, isn't it? We're going to have to do a phased return, to be fair.
Yeah, and it's just doing, it's having a combination of ways to support people. Zoom's had it's worked really well. It isn't for everyone. People do want that face-to-face contact, but like you said, some people are very anxious about returning to that straight away. So we'll probably continue doing both for the foreseeable, and see and make a decision in terms of going forward what we do. Colin, have you got a question?
That's not really a question, just well, I suppose it's a statement and a question. I've had a sneaky look at Stroke Association UK on my other computer.
Yep.
So obviously I'll send you a donation. So it's only going to be £20, not thousands. But
every little helps.
Yeah. The other thing I was going to say, do you get any government funding? Anything at the organisation? Do you get anything from the government?
Yeah, I mean, following because of COVID, I wasn't involved in it, but we did apply to the government for the COVID relief grant. I don't know what the terminology was, but we did receive some funding, and from that we were able to set up our 2 services. One was called Here For You, which was like an online befriending support, and also Stroke Association Connect. So this was for people where there wasn't a commissioned service in their local area. Health professionals could refer to this Connect service, where they got not the same level of support as our recovery service, but they were able to get some information, advice and support following the discharge from hospital. So we did receive some specific COVID funding. I'm not sure whether that's continuing, but apart from that, then we have it's mainly CCGs that fund our services.
I see.
Locally.
Well, hopefully soon. You probably will be able to visit the hospital soon, because I know that public governors will be allowed back into Warrington and Halton hospitals. Obviously, it's to the discretion of the CEO and the chairman and so forth, but I know there's talk that public governors will be permitted to visit the wards again at those 2 hospitals. So maybe you'll be in a, as I say, it's not my decision, it's the hospital's decision.
Sure. I mean, yeah, we've had discussions with the stroke ward at Whiston, because prior to COVID, we were there 4 days a week, offering support to stroke survivors and the families, and they've missed that, and they do want us to go back. So we're hoping that will happen in the next few weeks. So yeah, fingers crossed.
Yeah, fingers crossed. Thanks very much. That's been excellent. I'm really impressed. And
good stuff.
I'll send you money, and if a Scotsman send you money, you know you're on a good thing.
Well, I'm from Yorkshire, Colin, so there you go.
Oh, I've got no chance. Thanks very much.
No worries.
Does anybody else have any more questions? Anybody else got the hand up?
I can only see 4 people, so I don't know if there's anyone else.
No, I can't see any further hands up. But that was an absolutely fantastic presentation, Alison. I really enjoyed it. And I like the fact it was so interactive as well, with lots of questions and answers part way through. If there's ever anything we can do if you want to send anything across to us and we can raise the awareness of stroke, and there's anything that's kind of Halton specific that you could send us across and we can promote on our social media outlets. We've also got an e-bulletin that we can send it out on.
Okay.
And that we can do for you. We'd love, like Irene said, we'd love to come along when everything's getting back up and running, back into some form of normality. But yeah, that was absolutely fantastic. I thoroughly enjoyed it.
That's great.
Dave, is there anything else that you would like to add?
No, I've just sort of echo your comments really. Again, yet another really good presentation. And again, you learn things that you may have forgotten or you didn't know before. But just echoing it, Alison, thank you for coming along and giving a presentation. It is much appreciated, and I think everybody here seems to have enjoyed it. We will stick a copy of it up on Facebook when we get to record it up there. But if anybody needs your contact details, we'll pass them on. Could we have a copy of a presentation as well?
Yeah, more than happy to send it across. Shall I send it to Louise?
Yeah, that'll be fine, yeah.
And also you mentioned a fact sheet earlier as well. I think Irene mentioned the fact sheet. If you want to send it across to me or to Irene.
Yeah, I can send it as a PDF. That's fine.
Absolutely brilliant, thank you.
You can let everybody else go and enjoy the rest of their day. Well, it's sunny out there, I can't see. All I can hear is my neighbour, who sounds like he's building the Great Wall of China around, knocking all sorts up. So apologise for having to be fairly quiet. We look forward to seeing you at the next, anybody who likes to attend the next session, which Louise will be sending details out.
Yeah, I'll send some details. I'm just waiting for a couple just to confirm with holidays and things. There are different services that are just waiting to confirm on a couple of dates. So as soon as I get them through, I'll send everybody an email. But yeah, thank you, Alison. That was absolutely brilliant.
Brilliant.
Okay.
Enjoy the rest of your day.
Thank you very much. Take care, Alison. Bye-bye.
Bye.
Bye.
Thank you, everyone.